Hello friends, today we will go through some important questions MCQ which were asked in recently AIIMS Junior Physiotherapist examination. So let's start with the first question. The first question is distance from the point of heel strike of one extremity to the point of heel strike of the opposite extremity is called as, and the options are A. Step width, B. Stride width, C. Step length, D. Stride length, and the answer would be C. Step length. Moving on to the second question. Identify the test. Describe the patient lying in a prone with the knee flexed to 90 degrees followed by medial and lateral rotation of tibia by the examiner. Options are A. McMurray test, B. Lachman test, C. Applis test, and D. Clark test. And the answer would be C. Applis test. Moving to the third question, that is loss of axonal continuity with intact connective tissue coverings represent which type of nerve injury? And the options are neuropraxia, B. axonatomesis, C. neurotomesis, or D. neurolysis. And the answer would be B. axonatomesis. Then moving on to the next question, which muscle fiber has highest resistance to fatigue? And the options are A. type 1 or type B. type 2A, C. type 2B, D. type 1A. And the answer is A. type 1. Then moving on to the next question. While testing Romberg test, for how long the patient is instructed to stand with feet together? And the options are A. 10 to 20 counts, B. 20 to 30 counts, C. 10 to 20 seconds, or D. 20 to 30 seconds. And the answer is D. 20 to 30 seconds. Then moving on to our next question, that is which one of these is not considered as a primary impairment following stroke? And the options are A. aphasia, B. edema, C. impaired muscle tone, or D. impaired voluntary control. And the answer is B. edema. Moving on to our next question. Swan neck deformity is due to option A. contracture of extensor digitorum communis, B. intrinsic tightness, C. contracture of flexor digitorum profundus, or D. rupture or laxity of volar plate. And the answer would be D. rupture or laxity of volar plate. Moving on to our next question. In order to prevent sharp pain is elicited beneath the gastrocnemius when the foot is dorsiflex. The finding is positive. This represent A. Tinel sign, B. Allen's test, C. Homan sign, D. Scobert test. And the answer would be Homan sign. Moving on to next question. Absolute contraindication to exercise testing is resting systolic blood pressure greater than 200 mm of mercury of Hg, B. resting diastolic blood pressure greater than 120 mm Hg, C. moderately severe valvular heart disease, recent complicated myocardial infarction. And the answer would be B. resting diastolic blood pressure greater than 120 mm Hg. Moving on to our next question. Diabetic neuropathy can be most appropriate described as motor polyneuropathy, distal sensory polyneuropathy, sensory motor neuropathy, distal motor neuropathy? And the answer is B, distal sensory polyneuropathy. Thank you.